History has always been shaped by those who dared to dream what others could not. A dream is only as powerful as the will to make it real. Today, that dream is transforming lives across the world. What began as a bold idea is now a living, evolving reality. Across hospitals, across cities, across continents. A new era of surgery is already in motion. And this journey of SS innovations is only gaining speed.
We are very, very happy that today more than 10,000 patients have been helped with our technology. More than 200 systems are now in place. And we are very advanced in providing tele-operations, telesurgery, tele-proctoring, and continue to evolve in the world of science and technology to help humanity.
I think not only in India but also globally. So we've, since launching our product commercially, we were approached by many other countries, Nepal, Sri Lanka, Philippines, Indonesia, extending all the way to South America. We've since launched in Colombia, Iraq, many other countries, and then Africa, and of course, the US and Europe are next on our horizons.
Today we stand at a defining moment in medical history, where technology is no longer assisting surgery. It is reshaping how surgery is delivered, not in one place, but everywhere. Because the focus has never changed, the patient.
The only reason patient comes to the doctors is to get better, so they can return back to their functional lifestyle.
The patient goes home early, he has less pain, less blood loss, and his recovery is faster. So this advantage of robotic surgery can be offered to many other patients, which was not possible before.
If we can reduce the cost to the patient, there are two ways to do it. One is to make the robotic system more economical, and the other one is to make the healthcare as such more economical.
With robotic surgery, एक अच्छे reasonable cost में जब हमें मिलती है, तो हम न केवल पेशेंट को सर्व कर पाते हैं, बट अब ये जो डिफ्रेंसिएशन है कि बड़े शहरों में ही ये इलाज हो सकता है, छोटे में नहीं हो सकता है, ये अब ख़त्म है।
2 तारीख को जैसे ही मेरी वाइफ ने मेरे को किडनी दी, मेरा ट्रांसप्लांट बहुत अच्छा रहा, सक्सेसफुल रहा। उसके बाद 2 तारीख के बाद 3 तारीख को आईसीयू में ही डॉक्टरों की टीम आई, उन्होंने मेरे को 3 तारीख को ही चला दिया था खड़ा करके।
रोबोटिक सर्जरी करने के बाद अभी मुझे बहुत अच्छा फीलिंग हो रहा है, बढ़िया रिकवरी भी है, और आज मैं चल सकता हूँ, फिर सकता हूँ, अपने परिवार के साथ बैठ सकता हूँ।
मेरी रिकवरी बहुत अच्छी हुई है, बहुत फास्ट हुई है और बहुत जल्दी हुई है।
मैं किसी और को सर्जरी करनी है और अगर मुझे पूछेंगे वो, तो मैं रोबोटिक सर्जरी उनको सजेस्ट करूँगा, वही करनी चाहिए।
So surgeon skills, knowledge, added technology will give the benefit to the patient.
And it is already happening that people who are living in villages deep inside rural area in India, they have come to know about robotic surgery now.
Truly, all patients get access to minimal access technology and changes the dynamic and the healthcare, which is the right of every patient.
Yeah, so at the end of the day, ultimately, the patient and patient safety is paramount.
What started as a system is now becoming a connected ecosystem, where surgical intelligence is no longer confined to a single operating room.
By this telesurgery, we can easily operate any kind of surgery in Tier 2 or Tier 3 city. I think this is the main game changer in any field.
Of course, we're the only company in India or platform in India that's being utilized for telesurgery. So since we officially announced telesurgery, we've been doing now successfully more than 150 telesurgeries of all types, including cardiac surgery, which is very complex.
SSI Mantra has introduced telesurgery very early in India. Already I have done from Hyderabad to Moradabad, and wherever it is, if the 5G net or fiber cable from any network is there, we can do, then it will go to the taluk of the India also.
And this is very important because in a big country such as India, majority of the population live in Tier 2 and Tier 3 cities. And if patients there can access this kind of technology, that really truly democratizes surgery.
SSI has penetrated across India, and I believe in next 3 years, maybe every taluk district places we will have a telesurgery chair and SSI Mantra robot. So pan-India robotic becomes a household surgery accessible to all, rich, poor, first tier, second tier, village, non-village, and metro, non-metro, to all the people.
It is already happening. 24 complex telesurgeries completed within just 12 hours. A demonstration not just of possibility, but of scale, of precision, of trust.
We recently did this telethon. We got global or world record, for it, where 24 telesurgeries were conducted successfully in 12 hours. 9 surgeons had come on site here to our SSI headquarters here in Gurgaon. What that means is that 9 experts could now extend their expertise to 24 patients located throughout the entire country.
And we have now done many telesurgeries across the continent. In fact, the longest distance was 10,000 kilometers. So we were able to do cardiac case from France into Indore.
For the first time, distance was no longer a limitation. And with Mantrasana, a telesurgeon console designed for a connected world, a new way of surgery is born. With immersive 3D visualization, intuitive control, and seamless connectivity, it is a command center for a borderless surgical future.
The surgeon who is doing a telesurgery, he does not need the rest part of the robot. He just needs the chair console. Only with that chair itself, you can help do telesurgery at any part of the world.
Now imagine this chair could be placed in your outpatients or in an office, and you could get the best expertise that there is available in your institution and democratize that to anywhere in the world.
So the idea with Mantrasana is that an expert surgeon can be sitting in their office. They can stagger their cases. So one room will start at 10 a.m., the next one at 12 p.m., the next one at 2 p.m. So stagger the cases, and then you can just go from operating theater to operating theater, remotely.
I was not very convinced when I was explained about the idea. But when I sat and did my first surgery, which was supposedly the first robotic weight loss surgery on Mantrasana, I could feel it is better than the routine console.
So I think Mantrasana is a great addition to our armamentarium, giving surgeons the abilities to extend their expertise.
So this is the need of our in a large country like ours to make it affordable, accessible to all the patients.
But what if care could reach even before infrastructure does? Introducing SSI Vimana, a drone-deployed surgical robot, where time is critical and access is limited. Care arrives when it matters most.
So I think when Professor Sudhir Srivastav came up with the concept of telesurgery, this was his brainchild. He told me long back about this, that Mohit, I'm going to develop a technology which will reach the battlefield, and one of the soldiers have been shot with a bullet which is there in his legs or in his chest and his lungs, and this drone can go there and can operate upon the patient entirely and can get back safely.
We were actually requested by the Indian Army to develop something that could be sent out to the remote areas or in battlefield situations, so that in any sort of traumatic case of the soldier might have suffered, a traumatic injury that a soldier might have suffered, then this drone will be able to fly on top of them. Then through telesurgery and the use of a miniaturized robotic system, at least be able to stabilize them.
So not only it will have army application, but also sometimes these various things occur, earthquakes or anything else, which opens up many challenges about really getting to the patient. So again, this mobile aero drone-based unit will be very helpful in getting to the patients and provide the immediate service.
SSI Aero, this will redefine the whole emergency surgery, battlefield, trauma, accident, combination of all three. And first time SSI Mantra is equipped with all the three to do this, which will revolutionize emergency surgeries, not only in India, across the world and globe.
SS Innovations is always a step ahead of the curve. With Project Operion, a reimagined surgical environment, where advanced surgical capability is no longer fixed but travels to the patient.
We want to offer everything to the patient near his house, where the travel related stress can be reduced, the expenses of going away from home can be reduced.
Not only the patient has to travel, but now their families also have to travel, staying in hotels, eating in restaurants, etc. So now with our mobile operating room, we can bring the care to them.
Second tier city, third tier city, taluka places, small nursing homes, small hospitals, single specialty, multi-specialty, all of them are able to afford and take this.
Any technology is only going to be useful once it reaches the masses. So this decentralization will help a big way to train and, more importantly, treat patients across the country.
From the patient's viewpoint, they don't have to travel to get the expertise. And since today technology exists allowing surgeons to be able to operate from wherever, and I think this is a tremendous evolution that will help patients and the families.
This is the true shift, where the best surgical expertise is no longer limited to a few locations, where advanced care becomes accessible across Tier 2 cities, across rural regions, across the world. A world where every patient has access to the best possible care. Every procedure, every connection, every innovation, taking us closer to a future where healthcare has no boundaries.
Future of surgery would be error-free, standardized, AI-enabled, ambulatory surgery, accessible by surgeons sitting anywhere in the world, including his office or in vacation or other, and reproduce same result by different type of surgeon across all.
Cost-effective, accessible robotic surgery being democratized by the current platform, and also Mantrasana is going to completely revolutionize the way surgery is delivered around the world.
Whether it is orthopedics, whether it is neurosurgery, whether it is brain, heart surgery, abdominal surgeries, urology, my core branch, kidney transplant, robotics and technology will reach everywhere.
Mostly these things gonna be very minimally invasive, where something will be entering inside the lumen through a scope, and all the procedure will be done endoluminally. You will not have incisions on the body in future.
You will use a lot of technology to make the diagnosis fast, treat effectively without pain to the patient.
So now how to find creative ways utilizing technologies aligned with our company mission and vision to be able to actually effectuate that positive change. And we're using India as a model initially, but that model is now spreading globally like wildfire.
We didn't just imagine the future of surgery. We are building it. Because when distance disappears, care reaches everyone.
And we really hope that this care truly becomes global. The divisions actually dissolve. We start to look at how we can help each other rather than finding ways to destroy each other.
SS Innovations, defining the future of global healthcare.